We're going to be breaking down, and there's a steering committee that's being formed, and there's 12 different people that are beyond that.
It's made up of different elements of the community involving the police force, educational system, mental and medical health, and other pertinent parties. We're hoping to come up with a plan to address the different areas of society, the different segments of society, so that we can get the word out about what's going on in Geauga County and how we can improve it.
We're going to discuss ways of preventative maintenance as well as disposing of these harmful drugs that we have. People have them in their medicine chest at home. If they're not using them, they need to dispose of them properly with the Sheriff's Department, where they have a depot for that. They're talking about putting other disposal areas with police departments. When this is done, of course, education has to happen, and I think the schools are working on that. And all the expertise of the community, people are going to get together and try to do more to educate parents. I think a lot of parents are surprised at what is going on.
Here in Geauga County, we have a 10% opiate addiction of the population. So, and our population is about 95,000 here in Geauga County. So you figure about 9,500 have some type of opiate addiction. Now, in Geauga County, down in southern Ohio, they have a 64% addiction rate. So, fortunately, we're not as bad as the southern areas of the state, but we want to try and hone in, on what we can do to help our community. It affects every socioeconomic level, from the poverty level to the very wealthy. I've seen very wealthy families addicted to the impoverished community, and in turn our theft rates going up because people are stealing to provide for their addiction. I had 5 heroin addicts in my courtroom in the last week and a half, and only one was actually charged on a drug case. The rest were theft or some other type of crime or traffic matter, and there's heroin involved or an opiate problem.